Hello, everyone. My name is Urina Shrestha. Welcome to session 4 of International Student Fair. I am Urina Shrestha, your host for today. I'm also an education consultant in ACC Sydney office. So today we're going to talk about upskill in mental health and well-being to stand out in job market. So I have briefly listed our agendas today. So the first one would be the mental health course overview. The second would be the job career outlook for mental health worker in Australia. Third would be pathways to become a mental health worker in Australia. And then we have further study pathway after diploma of mental health. So for that, for all this discussion, we have our dynamic and gorgeous panelists here with us. Let me introduce each one of us. First, we have Michelle Humans, a National Course Coordinator, Community Services from Australian Learning Group. Welcome, Michelle.
Thank you so much. Lovely to be here.
Thank you so much. Thank you so much for joining us today. Second, we have Donna Hunter, trainer and assessor and practitioner in mental health industry, also from Australian Learning Group. Welcome, Donna.
Thank you
it's
so
lovely
much
to have you here.
Thank you so much for having me here. It's a pleasure.
Also joining us today is Carmen Mendez, the CEO of the organization More Than Support. And she's also, the organization is also the ALG's industry partner. Welcome, Carmen.
Thank you. Thank you for inviting me.
Lovely, lovely to have you here. Okay, so the basic thing we're going to do here in the session is like I'm going to ask some of the questions relating to mental health to all these panelists, and then they will help us to provide as much information as they can so that you students can benefit from it. So before moving on to the questions, I'd like to inform, in fact, it's an announcement that we have a $100 digital gift card, basically a MasterCard for the students. So basically, I'm going to ask a simple question at the end of our session based on the discussion that we're going to have today. And the first one to answer will get $100 digital MasterCard. So yeah, without any delay, we'll start. I'm going to stop sharing my screen so that we can see our gorgeous panelists. Okay, just give me a moment. And also, you can put down your question in the question and answer section here so that we can ask the panelists at the end of the session. Okay, so let's start with Michelle. So Michelle, Australian Learning Group, being one of the popular providers for mental health course, can you please give us an overview of mental health program in ALG? So it can be the units covered or the hours required for work integrated placements.
Absolutely, happy to. Well, as has already been mentioned, ALG provides the Diploma of Mental Health for students. Our course at ALG runs for 24 months, so it's a 2-year course. That's across 8 terms, and in the Diploma of Mental Health, we do 20 units of competency. So we have a thing called Common Cycles, where you'll do a few terms of some foundational units, and then from there, we really specialise into units that are specific for the mental health industry to make sure that you are learning the necessary skills and ultimately industry ready at the end of the course. A really key part of that involves work placement. So students studying the Diploma of Mental Health will be required to go on 2 work placement blocks. They consist of 200 hours each, and it's over a term at a time, so 10 weeks. We normally have students going for about 3 days per week, and students can either nominate a place where perhaps they're employed or somewhere that they would like to do their placement, and ALG also offers that support to help place students. So that's generally kind of the structure of it, and I can share if you'd like a little bit about what the course actually covers.
Of course, yes. If you can share that, it'd be really helpful for our students listening to this session. Yeah.
Absolutely. So we, as a mental health worker here in Australia, there are lots of different programs, different funding out there. So our course really aims to provide students with the skills that as a mental health worker, you'd be providing for clients or patients. So essentially looking at helping to support and resolve psychological issues, referrals to other support services as well. It can include things like micro-counselling, advocacy, providing psychoeducation or health promotion. So really looking at mental health holistically and what we can do in terms of best supporting the people that we get the honour of working alongside. So students will actually learn a really key skill, which is around recovery-oriented practice. So that's kind of a framework that we work within in the mental health industry. And again, it's looking at people as whole beings and how we can really support clients in terms of their health, their wellness, their social and emotional well-being, and essentially their meaningful participation in society. So we'll learn lots of practical skills and also knowledge about how to do that.
That's great to know, Michelle. Thank you so much. So moving on, I have a question for Donna, actually. So Donna, I have introduced you as a trainer and assessor, but if you could please provide us more about your role in ALG, and also how do you support to international students?
Yeah, sure. Would love to do that. So I work as a trainer and assessor originally in Melbourne, which is where I was working with the college there. I'm also in private practice as a clinical counsellor and work in wellbeing as well. Part of my role is to try and draw on my experience of being in the field for 10 years to apply that to the learning that the students are engaged in the different units of the diploma, so that then they can have concrete examples of how to contextualise their learning into some sort of understanding of how they can apply it to Australia. And part of my role is to support them in their understanding of the information that they're learning and to practice the skills that they're learning as well, that they'll apply in the workforce. So understanding the knowledge, and sometimes there is some barriers around language there, which us trainers help students to overcome as well when they're understanding different terms and terminology and different concepts that we're teaching them. And we do that in a number of ways, practically, as well as through different workbook activities, teaching, demonstrations as well in classroom, as well as things like that. So we support students not only, I find it's just not about academic support as well. We get to know our students and you build a relationship with students, and you're supporting students emotionally as well sometimes, because it is hard to be in a country where your family isn't, and particularly as in light of COVID, of what we've been through just recently, we're the first point of call of students who might need extra support, and linking them into the right sort of departments of ALG to get that extra support if they need other support as well. Michelle, is that?
Thank you. That's great to know, Donna. So yes, sure. So now let's move to Carmen. So Carmen, thank you so much for joining, first of all. And if you can please briefly introduce the organization More Than Support to us, and how does the collaboration with ALG benefits the student who really does work placement in More Than Support?
Yeah, sure. Well, More Than Support is a disability agency. We provide services to people with physical and mental health issues. in a holistic way, where we are involved with different health professionals, such as doctors, nurses, mental health, psychologists, psychiatrists, OT, occupational therapists, speech pathologists, and even physiotherapists as well. We have been providing placement to ALG students since, I can see, maybe almost 1 year. The thing we can help students to put in practice all the theory that they learn at ALG. As Donna said, it is something, it is like a new language that you have to become familiar with. To talk a little bit about myself, I'm a medical doctor. I'm a doctor from Venezuela, South America. I worked as a doctor for 8 years. Then I came to Australia. And I just become passionate about what I'm doing now and what we are providing for clients and even for students. I really like to provide the skills that I already got back in my country and here in Australia. One of the best services that we provide is introduce students, or actually I'm directly involved with the students. We talk about different aspects, different clients, different cases, and the best thing that we do is introduce them with real cases in hospitals, home, or any part of the city. We provide services, or we are providing work placement to students in Melbourne, in Gold Coast, and we are opening some branch in Sydney, Perth. So we are around Australia providing placement and education as well to students.
Thank you so much for all the detailed information, Carmen. Okay, I think, all right, let's move back to Michelle. So when like student come us for mental health course, the basic knowledge would be diploma of mental health to the student. So what is a further pathway after studying diploma of mental health that the student can go for? And what would be the requirement to be a successful mental health worker?
Great question. That's really the end game, isn't it? That's why we do what we do, is to eventually think about the work that we want to do. So I guess to give a bit of perspective around that, in terms of the mental health course, ALG does provide counselling and community services as well. So mental health is quite specific, and as Carmen and even Donna have spoken to, it is really that holistic perspective, but you do learn a lot specifically in terms of mental illness, in terms of kind of more acute cases, or what we would say practicing mental health in different settings. So it could be the more clinical side of things in hospitals, it could be in community mental health, and it could be in, like Carmen was saying as well, disability services, where you're doing prevention, early intervention, recovery at all different points. So I guess from a further pathway perspective, I guess even before I get to that, one thing I will say is that in Australia, the Australian government has just released their most recent budget, and mental health is one of their key priorities, particularly post-COVID. As most people would be aware, any kind of pandemic is going to have some lasting effects, and one of those things that I think each of us are aware of is the impact on mental health. And so the government has committed finance. So it's good news in the sense that there will be services and funding available. So job opportunities are going to be, there for students to move into. In terms of, I guess, from a personality perspective, or some of the softer skills that we recommend students are aware of, really around, Carmen again mentioned this, it was that passion and that desire to want to care. You know, sometimes we forget that it is really that simple as well. And then the course will equip you with the specific skills and knowledge to know how to actually direct that passion and care. A really key one as well is an ability to make sound decisions under pressure, or the ability to deal with crisis situations. We learn in the course as well when mental health can be occurring at the same time with other things. So for example, substance use, drugs, alcohol, and there might be more than one mental illness or mental health experience that someone is encountering. So an ability to do that, or a desire to want to learn how to do that. Excellent interpersonal and listening skills. So again, that desire, you don't have to have all of that ready to go. We teach you that, but that desire. And the really key one for me is empathy. And simply, that's an ability to connect with someone else and know or connect on a level of what life might be like for them, and find points of commonality in the work. So we see ourselves in other people, and that we all have common needs and common wants. So in terms of further pathways, in terms of jobs, you're looking at things like mental health community worker. It could be an alcohol and other drugs worker. So again, post this course, pathways could lead to specialisation, what we call specialisation, which means you might have really enjoyed learning about alcohol and other drugs and how that impacts people. So you could either go on to do further study in that. There are Cert 4 diploma level courses that you can do, or you can move into jobs that you might be in that field. More generally, community workers, welfare workers, support workers. One of our students recently got a job as a recovery coach. So again, working from that recovery oriented perspective and helping people to, just have health in their lives and meaningful engagement in society. What does that look like for them? One that's really popular in the mental health field is what we would call a peer or a lived experience support worker. So the real benefit in mental health is that each of us, I think the stats are around 20% of the population, but post-COVID, it's even risen to, I think it's about 46% of all Australians will experience some mental health condition, most likely around depression or anxiety. So most of us probably have our own experiences or know someone that does. And one of the key things in the industry in terms of jobs are employing people that have had that lived experience, that may have been through some of these support systems. And really their role is to support other people who might be at a different stage in that process to help them navigate through that. So that's a really key one as well. So also, we are in partnership with a higher education provider called ICON. Currently at ICON, we do provide the Bachelor of Counselling and Psychotherapy. So it might be that you think, do you know what, I would love to move more into the therapeutic side of things. We are looking at credit options for our students to be able to get advanced standing into that course. So that they would be the key pathways for students studying the diploma.
Thank you so much, Michelle. That was really informative and detailed. So keeping more emphasis on job opportunities, I'd like to ask Donna, because she's already working as a mental health practitioner. What are the job opportunities? How does the industry in future look like for the student in mental health area?
Yeah. Well, I work specifically as a private counsellor, but I have worked in education, in wellbeing as well over the time that I have been working. I specifically have a Bachelor in Counselling and Psychology. And as Michelle said, you know, counselling has really studying counselling is very different, and I just want to address the question that came up around what's the difference between a diploma of mental health and a diploma of counselling. Very different perspectives in the industry, both part of the helping industry within Australia. Mental health, you're more looking in community services and support roles within organisations, and counselling can get you into those roles as well. But for counselling, you can do a diploma of counselling and become a counsellor yourself and just have private practice. But it is an entry level into the industry, and recommend that you go on to do higher study if you choose to do counselling. But you can get roles, school counsellors, chaplains, those sorts of things. I find in the industry, mental health carries a lot more weight than counselling degree in community services, or community services degrees as well, or diplomas. But working in the field in mental health, there's a lot of opportunity, as Michelle said, to be working in organisations you can work in early mental health within school education. You can work in aged care at the other end as disability, peer support workers. There's just so much opportunity, and the government does pour a lot of money into helping people, because really, when we think about it, we all have mental health. We're all susceptible to experiencing, mental health concerns at some time of our life. It's a bit like physical health from a holistic perspective. We have to maintain and look after our mental health, and I think it's being a part of the industry of being able to work alongside people. You've got to be passionate, but you've also got to, I think the wonderful thing about studying these types of helping industry diplomas like mental health is that you learn so much about yourself as well, because we're all human and we all experience different things at different times. And so by default, you go on a bit of a journey of growth yourself, but and that helps a lot in understanding and skills when you are in the industry. And there's a lot of support, as Carmen being, a partner organisation. I've been doing a few workplace visits, and the industry is very supportive of students and helping students and mentoring students to, reach their goals, just as we are as trainers, supporting students to learn the skills and knowledge to go out into the industry. But it's a very fulfilling role. You meet a lot of wonderful people, and it's nothing better than seeing somebody, have the right supports in place to reach their goals and to really have a meaningful and purposeful life for themselves. It is very, very rewarding, and lots of opportunity in Australia, because the government does value, and I think generally our communities value people's mental health. And even in the workplace, there's a lot of changes around, organisations taking responsibility for ensuring good mental health of workers and things like that as well. So it is a great industry to jump into.
And if I could just add there.
Thank you so much, Donna. Oh yeah, sure.
Just quickly, kind of speaking to your point as well about where things are heading and how that reflects in job roles as well. I think from my perspective, there's 3 key points. One is that there is a continuing focus on health promotion, prevention and early intervention, rather than just kind of recovery or reactive measures. So a lot of government money being put into what can we do to educate people around mental health, mental illness, more holistically, how to foster social and emotional well-being. So the jobs are going to reflect that as well, to be more based at the prevention, health promotion, early intervention levels. The other key thing that we talk a lot about, but it's going to be even more key, and we're seeing that in the rollout of the NDIS and particularly disability support providers, is really the person-centered approach, but also client choice. So really the clients that we get to work with, them having choice in terms of the services that they access, the people that work with them. So kind of the power being in the person's hands. So again, the jobs are going to reflect that the client gets to decide what is best for their life and what support they need. And the last one, which I think COVID has reinforced as well, is really an integrated approach. So at the moment, we've got lots of different legislation, lots of different funding, lots of different programs, and sometimes they don't necessarily all work together as best as we would hope. So I think the government really investing in some long-term strategies where you're probably going to see more government initiatives as well, and things that have a little bit more regulation, just so that we can get kind of a holistic approach in Australia to mental health. So that's sort of where it's going, and Donna and Carmen, feel free to add anything if you'd like, but that's going to be reflected, I think, then in the job roles that are being offered in the future.
I totally agree. I think there's a lot of work in the industry around that health promotion and early intervention, which is predominantly where I've been in education, teaching young people about mental health and supporting young people and families to recognise, you know, when there's symptoms of problems that are starting to evolve, and getting the right supports in place. Yeah, so it is a really, yeah, from that perspective, it's a great industry to jump into, definitely.
Thank you. Thank you so much, Michelle and Donna. It's really great to hear from you. The student can really get the overview of how the job market will look like in future. Thank you so much for sharing. So moving forward, I'd like to ask to Carmen that, you know, when student comes and study diploma, for example, diploma of mental health, the main thing they'll be looking after would be work placement. So I'd like to ask, what sort of a task are assigned to the students who does work placement in more than support?
Yeah. Well, yes. As Michelle mentioned before, about a very important point that is the NDIS. Our organization, we are NDIS provider, so we have to follow a lot of rules. We have to make sure that our employees and our students, they are aware about the system and how to work in this field. That means they have to be aware about all the policies, procedures, and all the legislation from the NDIS, because yeah, the government is putting a lot of effort or is investing a lot of funding in this field, but at the same time, they want to make sure that everything is in order. For us, the process to hire at some point to get students from ALG is that we do an introduction to them. We explain very well about the system, about the NDIS, and about our organization's rules and policies. Once we are sure that the student feel comfortable and they feel like, okay, I think I can do this, then we going out for patients, real patients or real clients. I really like to introduce first with simple cases for them to become a little bit more familiar, like to break the ice, like, okay, I can do this. How to become a very good listener, active listener, to know that to make sure that they are going to use all the skills that they already got from the college, from ALG. Then we started to escalate to challenging cases. That is the beauty of this, that we can provide services to clients that they are very simple to work with. But at the same time, I really like to work with them with challenging cases. I can mention a lot of cases now, but yeah, we can work with people who are suffering from anxiety, depression, to clients who are suffering from bipolar disorder, schizophrenia, that they are inpatient from in hospital, and we have to provide support in hospital as well. And the other task that we provide to the students is like they have to become familiar to work with clients for 2-3 hours and maybe shift a little bit longer, for them to know how is the daily activities that they are doing every day, and even to become familiar or to get involved with family members that is very important support, and we have to take into consideration, because we said before, we have to do a holistic approach, because it is not just the client, it's the client, family members, and all the multidisciplinary team. As Michelle and Donna mentioned before, we are putting a lot of effort in doing prevention. That is the best way to work with mental health clients. However, sometimes, we have to put in practice some recovery, and at some points, yes, we have to go for therapeutic support with counselors, psychologists, and mental health nurses as well. So I think, I can say from my perspective and from my organization that, we provide a very holistic approach to clients. And this is very, very helpful for students that they are starting to work in this field. And there are a lot of opportunities to work in whatever they want related with mental health. There are a lot of branch to work in. So it's basically that, is how to provide the proper skills for them to work with real clients.
Thank you so much, Carmen. So I'm sure you have students coming in from other institute as well, from ALG.
Yeah. So we provide placement to other universities, Swinburne University and Melbourne Uni as well. We provide placement not just in the mental health sector, we provide placement in the individual support sector. However, to be honest, they are very related. They are very, very, very connected. So and we have connection with important hospitals in Australia, such as Melbourne, Royal Melbourne Hospital, Sunshine Hospital, here in Queensland, the University Gold Coast Hospital. So I think it is a very, for a student who is looking for get a lot of experience and to work in the future in this field, I think this is a very good opportunity to get more, a lot of different cases and different type of disabilities and mental health issues to work with.
Okay, thank you so much, Carmen. So I'd like to move back to Michelle. So when it comes to mental health, like the number one choice would be ALG for sure. So how does ALG help students with trainings, workshops, presentations, any other events to develop career planning or employability skills for students?
Yeah, excellent question. Like I said before, that's the reason we do what we do. We study, and hopefully it's meaningful study so that students can get the support to eventually be employable in the industry. That's why partners like Carmen and More Than Support is just so critical and so valuable to the industry at large. So there are a number of things that here at ALG that we do to support students. Donna has touched on a number of those in terms of the support in class and during the theory terms. We do more generally have LLN support as well, language literacy and numeracy, just in terms of, I guess, mental health can be what we call, have a lot of jargon, so a lot of words that are specific for the mental health industry, and it takes a bit of time to kind of get used to some of that and how things operate here in Australia. In terms of employability skills, all of our courses naturally address employability skills, so it's really important from ALG's perspective that we're not just working on skills or knowledge in isolation in a classroom setting, but everything that we do is linked in with what are the inherent employability skills that students need. The key ones for mental health, I've covered some in kind of the what we say to students to think about when they apply, so that ability to be an effective listener, to communicate well, to develop and to display empathy. I think there's some of the really key ones. I think critical thinking skills as well, problem solving skills is really important. Networking skills. So one of the key ways that we really focus on students building up their employability skills is in work placement, because that's where they can actually have access to industry workers who can also support them and provide feedback in terms of what employability skills are going really well, and maybe what are some that they can support further and ALG can support further. In our classes as well, one thing that's really important is that trainers provide a lot of their own experience in terms of linking it back to the industry. So what are the employability skills? What does this look like on the field? We also invite guest speakers in from the industry. We have a thing where we do industry visits and we go on excursions and you actually get to see it in the context. And then we're always happy as well to provide kind of support with next steps. So those further employment steps or any kind of planning. Again, some of that career planning is going to be inherent in the actual course and what we do. So getting you to think about what kind of people do you want to work with? Are there particular issues that kind of interest you? So really looking at it from a reflective perspective and thinking about where are you heading in the future. And again, it could be that you do mental health, but down the track, like Carmen was saying, we often work with lots of different people, multidisciplinary teams. So it could be that you want to go into counselling, be an addiction counsellor, or you want to be a mental health nurse or a registered nurse or a trauma specialist. So we can certainly provide information around some of those pathways as well, but particularly what we focus on are the needed employability skills for being a mental health worker.
Thank you. Those were really interesting facilities for the student. No wonder ALG is a #1 for mental health courses. So I have a question for Donna. So Donna, you have been a clinical counselor for a long time. So what do you think the students should expect out of this profession, basically in overall mental health profession? So how do the day-to-day responsibilities look like?
So day-to-day responsibilities for me, because I work one-on-one, I also do couples counselling as well, but working within organisations, if you're like working as a counsellor within an organisation, is often around case management, where you're meeting with clients and using those active listening and core counselling skills to understand the needs of the client. And what the client wants to get from the service, and then being able to work collaboratively from a not only a recovery focused perspective, but a strength-based perspective as well, of drawing on the strengths and abilities of the client to help them to reflect on what their goals are within accessing services, based mainly on the needs, which can often put clients at risk, particularly if there's needs, for instance, for an example would be parenting skills or something like that, that's putting children at risk. Then, you know, you're linking in to other services, and whether it be formal or informal services, but also helping clients to understand and look at and reflect on what supports they already have in place, what they're doing well, where they want to head with, you know, what things they're needing, looking at trying to reach their goals. And often people who are experience mental health concerns, often their goals and their dreams around what they want to achieve in life get disrupted because it causes a lot of disruption. And so when often people link into services when they're in crisis and life isn't working, which is unfortunate, and that's why the government's putting a lot of time and money into earlier intervention to help people to understand you know, the signs and symptoms of when somebody is becoming unwell or developing a mental illness, and helping other people to understand how to support somebody to get the right sort of help that they need earlier. and sort of helping people to break down those barriers and break down the stigma as well of help seeking, because sometimes based on historically what people thought about mental illness, people feel ashamed or you know, scared or fearful of linking in. And so really creating that supportive space to validate people's needs and concerns and normalise, you know, what's going on for people as a part of the human experience, really. And it could affect anybody, even myself or any of us here. And then, you know, empowering them to make choices, as Michelle said. It's a collaborative, person-centred approach. And really, as a worker, we've got access to, we know what's out there and what supports are available, and we can make suggestions and give options and help the client to make informed choices. To access the sorts of supports and help them to monitor that process, that everything is working well for them, and to help them to stay connected in, because one of the things that happen with people with that do experience significant mental health is it's hard to stay connected into the supports that they need at the time. So that's where I've predominantly spent a lot of time when working in mental health. I do work specifically as a counsellor in private practice as well. At the moment, I'm seem to be doing a lot of relationship counselling of couples, and a lot of that has come out of some of the financial strain of what COVID has caused, and the strain that it has on relationships. And if we think about mental health from a holistic perspective, when one area isn't doing well, it affects all our other areas are impacted by that. And so, you know, really helping people, educating people around, you know, holistically looking at their life and where areas they're doing well and where areas they need support, and helping them to make, you know, positive choices to, you know, make good choices around their well-being. And I just wanted to sort of pull up.
Thank you so much for sharing that, Donna. Yeah.
Yeah, that's okay. There was another question here. I don't know whether you want me to address that as well. Would you like me to speak to that as well?
Yes, sure. Yeah, actually, we do have two questions by our attendees here. Yeah, if you could just give me a moment. So I think, so Sunshine, in one of our attendees, she has said that she's studying social science psychology at the moment. Am I eligible to do eligible, or do I need to study diploma, or are there 3 other options for me in order to work as a mental health worker or a community worker?
Yeah, I'm happy to start the convo, and feel free to jump in, Donna or Carmen.
Oh, yes.
If yeah, studying social science, and you've got there in brackets psychology, so I assume that that's sort of a major or a kind of your key focus in that degree. You certainly don't need the Diploma of Mental Health to work in the capacity of a mental health worker or a community worker. As both Donna and Carmen have said, there's lots of different roles that are available for people that have this background. And if you have a psychology background, that's fantastic. That's wonderful, because a lot of the things that we teach in the Diploma of Mental Health you're going to have already from your bachelor. So you certainly don't need to do the diploma in terms of working in that space. In fact, having a bachelor is often a requirement if you're working towards some higher level positions, or moving into more clinical work in hospitals, or therapeutic roles as well. So I guess it would depend on your goals and what you want to do and the types of roles. And the mental health diploma would certainly help to break that down a little bit in terms of what your options are, and kind of the on the ground skills and the practical exposure to the workplace as well. But you certainly don't need that in order to work. It's a great step to take, but if you're doing psychology, that will also open up doors for you.
Thank you, Michelle. So just the last question that I have for the session today, and it's for Carmen. So it's the most important question, actually. So are there any specific skills or experience you're looking for when you hire a mental health worker in your organization, Carmen?
Well, as I said before, I'm very happy receiving students from ALG because I'm sure they receive the proper knowledge, the theory part of the mental health. With that, I'm very happy to start with. However, always, because my team, we have a lot of specialists in mental health and psychologists. We do an interview for the student, and one of the actually 2 interviews, and one of them is with our psychologist, who is focused on the student and what they want and what they would like to achieve. And from then, yeah, we started to work together. But to be honest, yeah, I'm so happy receiving a student from ALG. They have all the theory knowledge. I really like to discuss with them about different aspects, different skills that I know at the start they feel a little bit uncomfortable because some of them, they have no relation or they don't have background related with psychology or mental health, medicine, nothing at all. Some of them, I can mention some examples. They are studying economic, marketing, or any another career that it is not related with mental health. And then they did a mental health diploma. They come with me, and yeah, they really do a very good job. So some of the students, yeah, they have background in psychology, medicine, nurses. They feel a little bit more comfortable working in this field, but if the student, they don't have anything related with mental health, still they can do a very good job. Yeah.
And if I could just add there on the topic.
Thank you so much, Carmen. Yeah, sure.
Sorry, just adding to that as well, I guess, from an employability skill set, because obviously different organisations have different requirements as well. I think, again, those key ones, we're kind of speaking to what Donna was mentioning about the day-to-day roles and that ability to communicate, the empathy, those case management skills, which if you break it down is really around the problem solving, the time management, the being consistent. But another big part which Carmen touched on was I won't say a love of paperwork, because we may never get there, but an understanding that we work in a regulated environment, and often with funding comes particular reporting requirements, and also just from a duty of care perspective, we want to make sure that we are documenting what we're doing, and that we're doing that in ethical ways and ways that are really aligned with the values of the sector. So it's another key employability skill is just that ability to be organised, to understand that there are reporting and often deadlines to meet. And then kind of on the opposite side there as well is that ability to connect, to build trust, to create safe environments, and to understand holistically how to support and work with. I always say work with, not for clients. So it is really just empowering and equipping clients in their journey. So that would be more specifically some of the key employability skills.
Sure. Thank you so much, Michelle and Carmen. So with this, I think we're in the end of the session, but I see we have some of the questions from our attendees, and I'm going to pick some of the question. So the first one is, what is the main difference between a diploma of mental health and diploma of counseling? So I think Donna or Michelle, any of you can actually.
I think, you know, both diplomas have overlapping units within them. And it depends where you're focusing and what your goals are, as Michelle says, as to what industry you want to to be a part of. Mental health is a very specific industry where it's part of the community services industry, really. And counselling is more a specific, to me anyway, from what I understand and where my pathways and what I've been doing in my life is working more one-on-one. You can work more independently as a counsellor, as a professional service, and Diploma is an entry level into that. At the moment in Australia, the counselling industry isn't regulated, but Australian Counselling Association and PACFA are working really hard with the government to regulate it, which means that eventually you'll need to have a diploma, a bachelor minimum to be able to register as a counsellor. If you were thinking of going down that pathway, it would mean that eventually in Australia you would need to have a higher degree, but the diploma is an entry level into that, whereas Diploma of Mental Health would get you into those support worker roles within community services. Michelle, I don't know what you want to add.
Okay, thank you so much for the answer.
Yeah, I completely support what Donna said there. Definitely the key thing that we try to make sure students are aware of is that with a diploma of counselling, it does not enable you to move into private practice. That normally does require a bachelor degree or a higher qualification. You could still do it, but I think, like Donna said, it is really an entry level, and so we just want that to be really clear. And certainly the way the industry is moving is that a higher qualification would be required for the counselling pathway. And mental health, again, I think Donna said this, it really has that community services focus. So it's really focusing on community mental health or even clinical things, but less about providing intensive longer term therapeutic support in terms of therapy, and more around, if it is support, it is the kind of more of a case management approach using things like strengths-based, person-centered or a recovery-oriented framework, social emotional well-being, those kind of things. So they do lead to different kind of career paths if you're thinking beyond the diploma, but certainly, like Donna said, there are units that cross over. Yeah, it really does depend on the goal.
Thank you so much for the detailed answer, Donna and Michelle. It was really helpful. So I think we can still take last question for the session. So this is from the attendee as well. It goes like, he's studying as public health with a specialization in health promotion. So would I be able to work with mental health facilities, or do I need to study a particular mental health course? Michelle, if you could answer the question.
You don't have to study a particular mental health course. Again, it's going to be because there is a bit of a lack of that integration across the board with all services. Different services are going to have different requirements of what you need to be successful in a job role. However, if you've got that background in health promotion, that's amazing. You're picking up and you're learning all the key skills that can be applied in those roles. So again, it's not, we don't in Australia have, you've got to have a diploma of mental health to work in mental health in the industry. The only things that are more regulated are if you are looking to become a psychologist or a psychiatrist or things like that, then you need to go through to a bachelor degree and also then get accreditation or membership with professional peak bodies. But at the diploma of mental health level, or if you're wanting to work in health promotion or do that kind of support work, certainly what you're studying is a great asset to that. It would then be really thinking about what skills and employability skills do you have from that and matching that with job opportunities and seeing how you go.
Thank you. Thank you so much. So thank you so much for the information that we have had from all three panelists with us today. Thank you so much, Michelle, Carmen, and Donna. So as I've mentioned in the beginning of our webinar, that one will be the lucky winner of the question that I'm going to ask now. So it's really simple. The one who answers the question first will get the $100 MasterCard from us. So the question goes like, what is the name of the course and the education provider that we discussed in the session today? So it's for our viewers. I'll repeat the question again. What is the name of the course and the education provider that we discussed in the session today?
Sid has put up a comment.
Oh, we've got one.
Oh, yes. So we got Sunshine Salvatore. Congratulations, Sunshine. You have got the answer right. Yes, it is Diploma of Mental Health, and the education provider is ALG. Congratulations, you've won $100 MasterCard from us. We'll email it to you within 5 weeks, sorry, within 5 businesses, let's say. So yes, thank you so much, viewers and the panelists, for joining the session today. For any other question, if you have, you can always visit our offices in Melbourne, Sydney, and Brisbane. You can also visit our official website, www.aaccglobal.com.au, and also please do visit our social media pages in Facebook and Instagram. So thank you, everyone.
Thank you so much for having us.